Sometimes the G-button comes out before it has been in place 8 weeks. If this happens, it is very important to get it replaced as soon as possible. A doctor must make sure it is put back in correctly. Contact the pediatric surgery clinic right away for instructions. If after hours or on the weekend, you may need to have the operator page the provider on call. Be sure you know if your child has a non-balloon or a balloon type G-button. If a non-balloon G-button comes out, it must be replaced by a provider. Because the stoma will begin to close within 2 hours, it is important to contact the pediatric surgery clinic at once. If it is after hours, go to the emergency department. You can cover the G-button stoma with gauze or a washcloth until the G-button can be replaced. If a balloon G-button comes out after the first 8 weeks, you can replace it yourself. First, check the balloon for leaks by filling it with water. If there is a leak, use your backup G-button. If there is no leak, deflate the balloon. Next, put lubricating gel on the end of the G-button. This will make it slide easily into the stoma. Then fill your syringe with the correct amount of water. With the balloon deflated, push gently to guide the G-button down into the stoma. The balloon G-button should slide in easily. If it does not slide in easily, it is okay to gently twist the G-button like a screw. Do not force it. Push the G-button all the way down until the top of the G-button is flat on the skin. Once the G-button is in, you can inflate the balloon with fresh water. To do this, hold the G-button in place and connect the syringe to the balloon port. Slowly push the water into the balloon. This will inflate the balloon and keep the G-button in place. If you cannot put the G-button back in easily, cover the site with gauze or a washcloth and contact the pediatric surgery clinic. If it is after hours or on the weekend, go to the emergency department at once. Remember, the stoma will begin to close within 2 hours, so get help fast. Do not check the balloon until the G-button has been in place for at least 8 weeks. If it has been in less than 8 weeks and you have concerns, contact the pediatric surgery clinic. After 8 weeks, it is important to check the balloon once a month. You should also check the balloon if you see more leaking or if the G-button seems loose. To check the balloon, you will need a glass of tap water, an empty glass, and a syringe. Here are the steps to check the balloon. Attach the syringe to the balloon port. Gently pull back on the plunger. The water from the balloon will flow into the syringe. To refill the balloon, throw out the old water from the balloon. Fill the syringe with the correct amount of water. Slowly push the water back into the balloon. It is important to never fill the balloon with more water than ordered. If you have concerns about the balloon, please contact the pediatric surgery clinic. Medicine and formula can clog or block a G-button. Flushing the G-button after medications and formula helps to prevent a clogged G-button. If the G-button is clogged, contact pediatric surgery for instructions. We may need to replace your child's G-button. All G-buttons may leak at some point. You may see more leaking when your child is playing, straining, crying, or sitting for long periods of time. A leak that is enough to soak your child's clothes is not normal. You should talk to your provider. If you think there's a problem with your child's G-button, have this information when you call. How does the skin look and feel? Does your child complain about how their G-button feels? Look for redness that is solid or spotty, bleeding, crusting, granulation tissue, puffiness, or if the area feels warm to touch. Look for drainage from the site. Let us know what it looks like. Is it clear, watery, formula curdled, bad smelling, green, or yellow colored? If there's a rash around the site, does it have blotches, blisters, cracks, bumps, or look like pimples? Leakage of stomach fluids, pressure on skin from the G-button, moisture, drainage from granulation tissue, infection, or a heat rush can all cause irritation. Sometimes a bump of red tissue grows out of the stoma and around the sides of the G-button. We call this granulation tissue. The tissue is red and fluffy looking. It may look like a blister. It can be moist, ooze, and bleed easily. Granulation tissue is not harmful, but it can be uncomfortable. Moisture, the G-button moving up and down, or a G-button that doesn't fit correctly can all cause granulation tissue to grow. If you notice granulation tissue, keep the site clean and dry. Try to keep the G-button from moving around. Sometimes granulation tissue dries up and goes away in a couple of days. If it does not go away, call the Pediatric Surgery Clinic.